A fracture is a medical term for a broken bone. This happens when a force against the bone is stronger than the bone itself can handle. Think of it like a tree branch snapping under too much pressure. Our bones are incredibly strong and can withstand a lot of impact, but they do have their limits. These breaks can range from a tiny hairline crack to a complete shatter of the bone into multiple pieces. It is a common injury that can happen to anyone at any age, from a fall on the playground to a car accident. Understanding the nature of the break is the very first step toward proper healing and getting you back on your feet. There are many different ways to classify fractures, and each type requires a specific approach to treatment. A simple fracture is a clean break where the bone is broken into two pieces. On the other hand, a comminuted fracture is more complex, where the bone has shattered into 3 or more fragments. An open or compound fracture is particularly serious because the broken bone pierces through the skin. This creates a risk of deep infection. Doctors also look at the pattern of the break, such as a transverse fracture, which is straight across the bone, an oblique fracture, which is at an angle, or a spiral fracture, which is caused by a twisting force. Another important distinction is between a stable fracture and an unstable fracture. In a stable fracture, the broken ends of the bone are still mostly lined up correctly, making it easier to heal. An unstable fracture means the bone fragments have moved out of their proper alignment. This type of break often requires more intensive treatment to ensure the bone heals in the correct position. Without proper alignment, the bone could heal crooked, leading to long-term problems with movement and function. Dr. Dilip Ortho emphasizes that a precise diagnosis of the fracture type is critical for creating an effective and personalized treatment plan for every patient. Recognizing the signs of a fracture is also very important for seeking timely medical help. The most common symptoms include sudden and severe pain, swelling, bruising, and a visible deformity in the injured area. You might also find it impossible to move the limb or put any weight on it. In some cases, you might even hear a snapping or grinding sound at the moment the injury occurs. If you experience any of these signs after an accident or a fall, it is crucial to see a doctor immediately. An early and accurate diagnosis is the key to starting the right treatment and beginning your journey toward a full and successful recovery. When you see Dr. Dilip Ortho for a fracture, the primary goal is to put the broken bone back into its correct position and hold it there while it heals. For many simple and stable fractures, this can be achieved with non-surgical methods. The most common treatment is the application of a plaster or fiberglass cast. This cast immobilizes the injured area, keeping the bone fragments perfectly still so they can knit back together naturally. In some cases, a functional cast or brace might be used, which allows for limited and controlled movement of nearby joints. This can help prevent stiffness while still providing the necessary support for the healing bone. For more severe or unstable fractures, surgery may be necessary. This procedure is called open reduction and internal fixation, or ORIF. During this surgery, Dr. Dilip will expertly realign the bone fragments into their normal anatomical position. To hold these pieces together, he uses special surgical hardware like metal plates, screws, rods or pins. This internal fixation provides strong and stable support from the inside, which is often essential for complex breaks. This advanced surgical technique ensures that the bone heals in the correct alignment, which is vital for restoring full function and preventing future complications or deformities. The type of treatment chosen by Dr. Dilip Ortho depends on several important factors. These include the type and location of the fracture, the severity of the break, and the patient's age and overall health. For instance, a fracture in a child might be treated differently than the same fracture in an older adult because children's bones heal much faster. Dr. Dilip takes a comprehensive approach, carefully evaluating every aspect of the injury and the individual circumstances. This personalized care ensures that each patient receives the most appropriate and effective treatment for their specific needs, maximizing their chances of a smooth recovery. Following the initial treatment, whether it is regular follow-up, during these visits, Dr. Dilip will use experts to monitor other bones. This allows him to check that the bone fragments are in the correct position. progressing as it should and catching any potential issues early on. Preventing complications is a critical part of the recovery process after a fracture. One of the most important things you can do is follow your doctor's instructions carefully. This includes keeping your cast clean and dry, as moisture can weaken the plaster and cause skin irritation or infection underneath. You should also elevate the injured limb as much as possible, especially in the first few days after the injury. Elevating the limb above the level of your heart helps to reduce swelling, which in turn can decrease pain and promote better circulation to the area. Ignoring these simple steps can slow down your healing and lead to unnecessary problems. Another potential complication to watch for is infection, particularly with open fractures or after surgery. Dr. Dilip Ortho will provide clear guidelines on how to care for any surgical incisions. It is vital to keep the area clean and watch for signs of infection, such as increased redness, swelling, pus, or a fever. You should also be aware of the risk of blood clots, which can sometimes form in the deep veins of the legs when you are immobile for a long time. Moving your fingers or toes regularly and following any prescribed exercises can help improve blood flow and reduce this risk. Never hesitate to report any unusual symptoms to your doctor right away. Pain management is also a key component of a smooth recovery. While some pain is expected, uncontrolled pain can make it difficult to rest and participate in your rehabilitation. Dr. Dilip will prescribe appropriate pain medication, and it is important to take it as directed. As your healing progresses, you will likely be able to transition over-the-counter pain relievers. It is also important not to put any weight on the injured limb until your doctor says it is safe. Putting stress on the bone too early can disrupt the healing process, misalign the fracture, and may even require another surgery to correct it. Patience is truly a virtue during bone healing. Lifestyle choices can significantly impact your recovery and help prevent future problems. A healthy diet rich in calcium, vitamin D, and protein provides your body with the essential building blocks it needs to repair the broken bone. If you are a smoker, this is an excellent time to quit. Smoking is known to significantly slow down the bone healing process by restricting blood flow and the oxygen supply needed for tissue repair. By taking an active role in your recovery and making healthy choices, you can create the best possible environment for your body to heal efficiently and effectively, minimizing the risk of any long-term issues. Once Dr. Dilip confirms that your bone has healed sufficiently, the next phase of your recovery begins physiotherapy. This is where a skilled physiotherapist, such as Dinesh, plays a crucial role. The initial goal of physiotherapy is to gently restore the range of motion in the joints that were immobilized by the cast or affected by surgery. Dinesh uses specific techniques like passive range of motion, where he carefully moves the joint for you, and active assistive exercises. These early movements help to reduce stiffness, lubricate the joints, and prevent the formation of scar tissue that could limit your mobility later on. This stage is about reawakening the muscles and joints. As your mobility improves, the focus of physiotherapy shifts to rebuilding strength. The muscles around the fracture site will have weakened from lack of use, a condition known as atrophy. Dinesh will guide you through a personalized program of strengthening exercises. These might start with simple isometric contractions, where you tense the muscle without moving the joint, and gradually progress to using resistance bands, light weights, and specialized gym equipment. This progressive strengthening is essential for regaining the ability to perform daily activities, from walking without a limp to lifting objects, and it provides better support for the newly healed bone. Beyond strength and flexibility, physiotherapy helps you relearn how to use your body correctly to prevent long-term disability. Dinesh will work with you on balance, coordination, and proprioception, which is your body's sense of its position in space. This is especially important after a lower limb fracture to ensure you can walk with a normal gait and reduce your risk of future falls. For an upper limb fracture, this might involve fine motor exercises to restore dexterity for tasks like writing or buttoning a shirt. The ultimate goal is not just to heal the bone, but to restore your full function and confidence in your movements. To ensure a successful recovery and prevent long-term problems, it is vital to be consistent with your physiotherapy program. Doing your prescribed exercises at home, as instructed by Dinesh, is just as important as your sessions in the clinic. Recovery is a partnership between you, your doctor, and your physiotherapist. If you have experienced a fracture and want expert guidance on treatment and recovery, do not hesitate to seek professional help. For a comprehensive consultation with Dr. Dilip Ortho and his dedicated physiotherapy team, please call +91 XXXXXX. Taking the right steps today is your best investment in a healthy, active future.